Good morning, and I'm really excited to be here today for this. This is our let me first start by thanking you, Mr. President, for being with us today, and for your Minister for being here as well. Kenya is one of our strongest partners in so many different fields, whether it's the fight that we've fought together against terrorism on the continent, but beyond that, in our own hemisphere, Kenya's played an extraordinary role, really heroic role in trying to help stabilize Haiti. It's a very difficult situation. They've carried a huge burden as a country for the better part of 2 years now. And had it not been for their engagement, and I just expressed this to President Ruto, as bad as Haiti is, it would be indescribable what it would look like today were it not for the efforts they've made. Our gratitude for the role they've played is extraordinary. Had it not been for the role they've played, what we are hoping to do next in Haiti would have been impossible, which is to transition to a gang suppression force. And we know there's a transition period, and we're going to be very involved in being helpful in bridging that. And we want them, and we hope to encourage them to continue to be engaged moving forward as we move into this new phase of trying to bring stability to Haiti. But we understand and believe they cannot do it by themselves. So I wanted to use this as an opportunity to continue to encourage countries in the region and around the world to step up and contribute and be a part of this effort. We need their money, we need their funds, and we need their personnel as well to make this work. If we had 5 or 10 countries willing to step forward and do just half of what Kenya has done already, it would be an extraordinary achievement. And we hope that that will happen. It needs to happen. If we're serious about it, it needs to happen. Everybody likes to have press conferences and put out statements about how terrible the situation is in Haiti. It's time to do something about it. And I particularly point to the countries in our hemisphere, in the Western Hemisphere, in the Caribbean Basin and beyond, that we need to step up in this hemisphere and do more. The United States will continue to do its part. But I just wanted to express again our gratitude. Today we're here to announce the first signing that we're going to have with the first country in the world on our America First Global Health Strategy. And I want to, for members of the press and the public that will learn about this through you, walk a little bit, very briefly, into exactly what the thinking is. The United States has spent billions of dollars over the years in helping with health strategies all across the world. What we learned over time, and especially after coming here, is that oftentimes, and I'm oversimplifying it, but this is an accurate description, what would happen is we would go to a country and say, we're going to help you with your health care needs. Then we would drive over to Northern Virginia somewhere, find an NGO, one of these organizations, give them all the money, tell them go to this country and do their health care program for them. That NGO would then take about some percentage of that money for their overhead and administrative costs. And by the time it got down to it, the host country had very little influence. It was sort of imposed on them. And only a percentage of the overall money ever actually reached the patients and the people on the ground that we were trying to help because of these costs. This makes no sense. So why are we hiring American and international NGOs to go into other countries and run healthcare systems that are parallel and sometimes in conflict with the healthcare systems of the host country? If we're trying to help countries, help the country. Don't help the NGO to go in and find a new line of business. And so that's what the model that we're breaking. We're not doing this anymore. We are not going to spend billions of dollars funding the NGO industrial complex while close and important partners like Kenya either have no role to play or have very little influence over how healthcare money is being spent. Bottom line is, if you want to help a country, work with that country, not work with a third party that imposes things on that country. And so for us, we hope to sign many of these in the days to come. But the first one we're going to sign is with Kenya. And the reason why is twofold. Number one, because of our close partnership. Number two, because they are they have stable and strong institutions, both in government and in the healthcare sector. And over the next few years, we're going to be investing $1.6 billion in health assistance over the next 5 years. And you'll see how that program works out. But the investment is in combination. It will allow us, first of all, to leverage the private sector to create a sustainable U.S. health assistance model around the world, and not just in Kenya, but this is the perfect place to prove that it's going to work, because it is going to work. And what it means is that money is not just going to be spent to provide medicine and care, it's going to be spent to improve the domestic infrastructure, healthcare infrastructure, so that in 5 or 6 or 7 or 8 years, countries will say, we no longer need this much assistance, if any, because we have our own system, you've helped us to build it, it's now delivering results, and in fact, we now, these like maybe Kenya, want to go and teach other countries how to do it. And this is a very real possibility, and it's something we believe in. By the way, Kenya, our partner. Okay, we're not imposing this. They're our partner. $850 million is what they're going to give to support these efforts. So this is truly a partnership. This is the way we should be doing assistance around the world. True assistance is self-sustainability, building the ability to sustain yourself in the long term. So it's an honor to be able to do this with you today. I'm excited. This is our first one. We hope to sign, I don't know, 30, 40? How many? 50. Okay. Well, this is number one. You'll always remember this one. You always, the first one is the one that, and we think we've picked the perfect partner. I thank you for being here today. I know you're also here. You're going to join us in a few minutes over at the Institute of Peace for another important topic on the Democratic Republic of Congo and Rwanda. So we're grateful you're here for both of these things, but it lined up perfectly. We are honored to welcome you to the State Department, Mr. President, and thank you for joining us today.
Thank you. Thank you, sir. Thank you.